Hello.
Yes, भैया we are here.
और अभी आज तो राहुल का सेशन ले रहा है।
Bhaiya, should we start now or we can wait for 5 minutes so the other people can also join in?
Yes.
Bhaiya, should we start now?
I'm ready. Yes, whenever you are.
Uh, Good morning, dear brothers and sisters. सभी को नमस्ते and hope सबका yoga session बहुत अच्छा था कल. So today we have an esteemed doctor with us, Dr. Rahul Mehrotra. Dr. Rahul Mehrotra is a cardiologist and he's a professor and the chief of clinical and non-invasive cardiology, Artemis Hospital, Gurugram. He holds an MD degree in medicine, DNB in cardiology, published more than 100 articles in national and international journals, and chapters in textbooks. He is keenly interested in exploring the scientific basis of spirituality. He has been practicing heartfulness meditation for more than 2 decades and is a trainer as well. He is regularly invited to international and national forums as an expert on science and spirituality. Welcome, Dr. Rahul.
Thank
So,
you.
for today's session is mostly based on from stress to mental ease. So, Dr. Rahul will be taking us through that topic. Over to you, Dr. Rahul.
Warm welcome, dear sisters and brothers. And it is not a very good time to talk about stress early in the morning, but it is a very relevant topic for all of us. I hope I will be able to take you through the different reasons for stress and how we can manage stress, particularly in context to senior citizens elderly citizens for which this program is specifically designed. Am I audible? Okay, thank you. Is my screen visible?
Yes, Dr. Rahul.
Okay, so the topic for the day is from stress to mental ease. So I will be briefly taking you through a presentation, say for around 20, 30 minutes, following which we will have some question answer. And of course, not without ending without a session of meditation. So from stress to mental ease, particularly for senior citizens, the golden years population of our world. So, what is stress? We keep listening to this term, stress. It is a very difficult to define entity, yet we all intuitively seem to know what stress is. Generally, it is defined as tension, mental strain, or any unpleasant situation which we are not able to face. We call it stress. And even people like my maid is using these terms. आजकल बड़ी tension है, आजकल बड़ा stress है. So we are all aware of what stress is, but scientifically it is a known thing. It cannot be treated as normal. It is a symptom and a disease, underlying problem. So we have described it in different ways, and scientifically it is said that it is a non-specific response of the body to any demand for change. But not all stress is bad. There is something called good stress also, which is eustress. And then there is something called bad stress, which we call distress. So this is what we call a human function curve. And all of us pass through different parts of this curve at different points of time in our lives. But if stress remains persistently in this orange and red zone, then we say that it becomes too much stress. We are not able to bear it. We call it sometimes burnout. People have emotional breakdowns. They need medical help sometimes, and sometimes it is irreversible. And mostly when we are too much into this red zone, too much stress which we are not able to handle, we call it manifested in terms of anger, irritability, restlessness, panic situation. We are not able to handle that situation, and that is a manifestation of too much stress. But surprisingly, there is some good stress also. If we are grown ups, we know we have children who would not like to study, they would always like to play. But it is good to have some deadlines, homeworks to finish, assignments to complete within a given time, which give us some kind of stress to finish the task at hand. And that is considered to be a good stress. Similarly, even for elderly people who are working, our offices, our workplaces have deadlines for us when we have to finish our work in a given time, in a given manner. And that's create stress for us. But this is a good kind of stress. Getting up early in the morning, reach the meditation hall for people who are meditating, reach before time, had a good seat. So all this ensures that we are put ourselves under certain kind of restraint, and that is considered to be a good stress or a stress. But the problem with this function curve is that we do not know when we cross the boundary from good stress to too much stress or harmful stress. So from optimum or good quality stress, we sometimes it becomes too much for us, and then we land up into this zone which is not good for us, and that is what is called a harmful stress. A very important slide, I always like this slide, is that we like to blame others for our stress. You ask somebody why you are stressed, we will say it is because of my boss, it is because of my family members, my children giving me trouble, or too much work at workplace. And we like to blame situations and outside circumstances for stress. But that is generally not the right thing to do. Stress is not in the situations outside. It is actually in the way we respond to the situations. So here is an example of a tram car. You can see it is very high above the ground. and there are four children. You can see the expressions, the attitudes of all the four children who are exactly in the same situation. You can see somebody who's scared to death, closing their eyes. Some people are taking it as an adventure, and someone is smiling even in this situation. So, same situation, different responses. And this is what stress is. If in a given situation we are able to respond appropriately, then the situation will not give us stress. But if we are not able to handle that situation, do not have a right perspective for that situation, we become stressful. So it is actually in our hands whether we respond to a given situation in a positive way or in a negative way. So scientifically speaking, we have divided stress into different types. We call it, generally we have divided into four different types of stresses which all of us go through. We call it work stress, work related stress. For housewives, for example, it can be the home, which is their workplace. We have domestic stress also, which arises because of interpersonal relationships between husband and wives, between mother-in-law and daughter-in-laws, between even parents and children, which keeps happening in every house at different point of time. All of us have to learn to manage our financial resources, which are limited, with our needs and wants, and this produces financial stress. Similarly, unprecedented life situations like disease suddenly happening to some of our family members, our friends. Disease like corona showed us that we are not prepared to handle these kind of life situations. Death in the family, breaking up of relationships like divorces, separations, which are becoming quite common now. Unrealistic expectations from life and situations. We often think that we have enough resources and we have very good hospitals, we are living at good times, so that we will be able to manage different disease and situations which they come. But usually it is not the case. We are usually unprepared, and it is not just financial resources or fancy hospitals that are needed for dealing with these diseases and situations like corona showed us. We need much more than that to be able to deal with these life situations which come suddenly unannounced to any of us. A very common life situation we encounter is now maids not coming on time, suddenly the maids going away, and we often discuss in our workplace that that is producing a lot of stress to people because they have to manage their home, workplace also, manage the family members also. And all these four stresses are interrelated. It is a very important concept to understand. If we are stressed at our workplace, if we do not have a healthy atmosphere at our workplace, we will be bringing that stress to our homes. And everybody at home will also get stressed. Similarly, if we are not having a healthy atmosphere at home, we will carry that stress to our workplace and influence our work. Our peers will also notice it, and they in turn will also get stressed. Particularly if the boss is not happy at home, he will take out that stress on the subordinates in the workplace, and everybody will be the sufferer. Similarly, if we are dealing with a financial situation, financial stress is there, then that will impact everything that we do, our home, our workplace, and the way we deal with our life events. A very important idea. Am I stressed? How to know stress? How to diagnose stress? And that is the key problem because there is no diagnostic tests. Aajkal, there is a question coming to us very commonly as cardiologists that what is the reason that young people are dying these days? Celebrities, apparently very healthy, very fit, following dietary programs, going out for exercise, even meditating, yet they succumb to sudden cardiac events. And people are worried that what is the cause. And sometimes I am told that we recently had a complete blood checkup done, a complete health checkup done, and everything was okay. Yet we had a heart attack in the family. Why is that? So there is no mysterious reason about it, The reason is that probably there was an underlying stress. Mostly there is an underlying stress which is not detected. There is some kind of fear, chronic worry, anger, frustration inside, which cannot be picked up in any blood test or any test that we do in a hospital, and which is the reason for a heart attack. And let me tell you, stress is as powerful a risk factor for heart attack or stroke as is any other, like smoking, cholesterol, diabetes, or even high blood pressure. So that is why it is often very underestimated. People don't like to accept that we are under stress because we see it as a sign of weakness. Men, particularly, are trained to grow up and claim that they are never stressed, they are very strong, they will never have stress. And if they confide that they are having stress, it is considered a sign of weakness. So we often hide this, we often do not accept that we are stressed, and that is why we are not able to deal with it. Sometimes we are able to diagnose in the hospital that when young people come to us with high blood pressure, or when elderly people tell us that they are looking sad, but they do not like to accept it, and yet they are having high blood pressure, multiple bodily problems, then we as doctors are sometimes able to say that the underlying cause seems to be some kind of stress which they are going through, and which is manifesting in different ways and forms, like different body aches, lack of sleep, high blood pressure, not taking medicines regularly, showing disinterest in coming to the hospital for doctor's visits. So all these can be sometimes manifestations of underlying stress, which as a doctor we are trained to pick up sometimes. Sometimes it is our family members who diagnose stress which we are going through. Women particularly are very sensitive in this aspect. They are able to pick up when the spouse or children are undergoing some kind of stress. Sometimes friends are able to pick up, like, what is wrong with you? Why are you not happy these days? What is troubling you? Our expressions give us away. And this is how it is picked up. So it is very difficult to diagnose stress as a doctor and otherwise also. We sometimes don't even know ourselves that we are passing through stress, and it is stress which is causing us different symptoms, like sleep is not getting proper, we are becoming irritable, restless, impatient, not getting interested in things we used to like in the past. So all these may be subtle signs of underlying stress, and sometimes it can be simple acidity, too much increase in acidity, palpitations, heart rate. As a cardiologist, we know that 90% of palpitations is due to anxiety and stress, and almost never due to a heart problem. Similarly, most acidity gas that people complain of is because of some underlying stress rather than just dietary causes causing heartburn, excessive acidity. Sometimes irrelevant perspiration, we are sweating in our palms, in our forehead, which is because our body is perceiving stress and our sympathetic nervous system is getting activated. So as a doctor, I'm talking about stress not because it is something which is not a medical topic, it is very much a medical term. And stress is a direct risk factor for many diseases, most prominent of which I have listed here. Something like bronchial asthma. A stressful situation is precipitating bronchial asthma attacks. I've already told you about heart attack and stroke. Stress is one of the 9 risk factors for heart attack and stroke, along with other factors like diabetes, hypertension, cholesterol problem, lack of exercise, etc. Similarly, stress gives rise to alcohol and substance abuse. People are under stress, they do not know what to do, they take to supports like alcohol, or particularly young people, they take to drug abuse. Similarly, chronic headaches. We have a term called tension headache. People report headache in their temples, and it is not because of any disease inside the head, except for stress, which is underlying. Even diabetes has a risk factor in the form of stress. So it is not to be underestimated, it is to be diagnosed properly, and it is to be treated properly. And we are a stressful planet. Most of us have heard the term pandemic when COVID came, but we in medical science already are calling stress as a silent pandemic for several decades now. More than 350 million people suffer annually from an extreme form of stress, which is depression. And the worst part is it is increasing. All strata of society is under stress. Our young children are under stress for different reasons. Our elderly citizens are under stress. Our the productive generation in their 20s and 50s are going through stress. For example, up to 40% of corporates in the US are offering stress management program in their offices because they are aware that stress is an important risk factor for the employees. And another example, there are very high rates of depression in some professions like the medical profession and the armed forces, because these are professions which deal with the life and death situations very commonly on a day-to-day basis. So it is said that in the US, this is data from the United States in 2012 suicide data report coming from US, that one war veteran in the US kills himself or herself every hour. Very, very high rates of suicide in the US, even though they are very well paid, very well looked after, but those are not compensations for stress, and these people commit suicide. Similarly, in our country, India has the highest rates of student suicides in the world, something we should feel very shameful about. We are putting so much stress on our younger generation that they are left with no option but to end this precious human lives in their own hands. A very sad commentary on the way we are running our society. And the worst part is that stress is not recognized. We often underestimate stress, we underreport stress, and that is why we are under treating this situation. So, what is the cause of stress? Who is giving us stress? Why are we not able to deal with it? We often blamed diseases like COVID. Heart attacks nowadays are being blamed. Sudden onset of heart attack. People are afraid that they will suddenly succumb. Spreading cancers. Earlier, we used to have very less incidence of cancer, diabetes, overweight or obesity. Most of these are attributed as causes of stress in people who are not prepared to deal with this situation. But scientifically, when we study the phenomena of stress, we've realized there are many different reasons why we are a stressful generation now. And these are some of the causes I have enumerated. We are no longer having joint families. We are living alone with nuclear family, just two people in a big house, nobody to talk to, nobody to share our worries with. Earlier, we used to have large joint families which used to act as shock absorbers. Families were defined as shock absorbers of stresses and strains of daily life. And the problem is so much that I am aware of at least two couples who are living in different towns, the husband and the wife living in different cities, and they don't even have a family living under one roof for several reasons. We are moving around very quickly. We keep changing the cities that we live in. For 10, every 10 years, this is even a long time. Every 4 5 years, people are known to change their jobs, change the cities, and then we have to make a new beginning altogether, which is very stressful for us. There are no more places of congregation like churches, temples, fairs. Earlier, people used to meet together very often in these places, and the whole village or the colony used to be very close to each other, sharing their troubles, sharing, discussing their problems with each other, and helping each other with finding solutions. So the community feeling, the connections are getting lost. We think we are connected with the help of Facebooks and Instagrams and WhatsApps, but this is known that it is not true. As human beings, we require much more than this very remote connections. We need close, intimate, and social connections. And the other very important reason is increasing wants, increasing ambition and desires, which we are running after, ever increasing demands, ever increasing requirements in terms of new models of phones, new gadgets to be acquired, new variety of clothings, trying to keep up with the times all the time, which is giving us a lot of stress as a society. So these are some of the causes I've enumerated. Our children are under stress, even the toppers, the very good students are known to be under a lot of stress, because even after accomplishing 99.9 percentile, I'm aware of people who are not getting admissions in good medical colleges or good engineering colleges. So, what to do? How much better can we go from being a 99.9 percentile? If you look at the newspaper, you will get all kinds of stressful situations. If you start your day with newspaper, you will be full of stressful things going on in your head. So it is best not to read newspapers early in the morning. Workplaces where we used to look forward to meeting our colleagues have become very stressful, targets to be completed. And this is a picture from Gurgaon going towards Delhi highway. Every morning, this is the situation. The national highway going to workplace. We don't know whether we will reach the workplace in time or not. And then we will be stressed, worried about the phone calls, patients already having reached the hospital, calling you, all kinds of worrisome thoughts coming to your mind. Open the television set, you will be worried about wars going on across the world, sudden bombings, terrorist attacks. And if you look at entertainment channels, this is something I've picked up from an entertainment channel, Saas Sena and Bahu Brigade. So there are war rooms created in our households. Every face is stressed. No smiles, no happiness, no joyful talk, no suggestions for leading a healthy, prosperous, balanced life, but only life situations becoming more and more complicated because of the complex ideas bombarded to us from this very powerful medium that is there in our households now. And all our impressionable minds are watching these kind of things, absorbing this, and creating more problems for ourselves. And this I call a very big cause of stress. We are never alone, always situations being shared with us, something having no relation to our lives is already coming to our pockets. We are forced to see that. We start thinking about those things and build up unnecessary stress. Anybody can call us anytime. We do not have alone time ever. We don't even switch off our phones for fear that people will not be able to contact us. And we are always under anybody's beck and call. Anybody can call us, disturb our peace of mind, and take away our periods of silence. This is a slide which is specially for the elderly people. Why is stress there in the elderly? And these are some of the factors which have been enumerated. Common reasons are health reasons. Like as we grow old, all of us have to face certain health issues like dwindling vision. Our vision will continue to go down. Our hearing will continue to go down. Our body will not work as efficiently as it used to. There will be aches, pains. There will be some kind of health situations like blood pressure, diabetes to deal with, multiple drugs to be taken. All this creates a lot of discomfort and creates stress for the elderly. Social issues, we will see our colleagues, our friends, our family members go to other world, leaving us. More and more loneliness, people we could connect with will gradually move away. We will have to move towns to live with our children, or sad situation, old age homes. And again, this kind of change, we will have to change our comfortable surroundings to new surroundings, which gives us stress. Very commonly, I've seen some people get a lot of stress after they retire, because having been used to a particular work environment, colleagues at workplace, suddenly you are no more important. Nobody bothers about you. You are not an authority over anybody. And it is very difficult for some people to cope with this sudden change. While some people are very happy to embrace retirement because they have other things to do, utilize their time in productive works like hobbies, culturally engaging situations, etc. And these can be some of the social causes of stress. Family and environment, suddenly we find that we are dependent. We are no longer independent as elderly people. We are dependent on others. We have to depend on others for helping us move around, helping us go to places, and that creates stress. Life changes also are not easily accepted. Of course, we are approaching something like death, which is not very much clearly talked about in our society. We have a lingering fear of death in our minds, which creates an underlying stress. We are not able to complete our goals. Sometimes, when we look back at our lives, we no longer can go back and correct the wrongs that we may have committed, which we would like to correct. We would like to change our lives, but we know that we do not have time left with us. And some people go under stress because we are left with no meaning. I have an elderly patient coming to me for the last few weeks. She's 85 plus, and she keeps complaining that I have everything. Children are very good looking after me. I have a big house, all kinds of comforts, but I have no meaning. I have no purpose in life. When I get up in the morning, I don't know why I am alive. What should I do? I have nothing to do. Nothing interests me. So, this is something which is also a reason for depression and stress. Search for meaning and purpose of life. And a very important situation is financial stress in the elderly. We do not have capacity to go and increase our earning at that age, and we are mostly dependent on fixed income and dwindling resources. Pensions are already getting closed in most societies, including in our country, and very poor social support for the elderly in our country, definitely increasing healthcare costs, government institutions not supporting healthcare, and it is mostly in the hands of private hospitals now, which have a fancy fee for all kinds of healthcare resources. Insurance is generally not covering very elderly population. Denials are very common. So this gives a lot of financial stress to the elderly people. And this is what we have to learn to deal with. But at the bottom of this slide, if you see, so stress cannot be accepted as a normal part of aging. We do not think that this is all normal. All this can be handled, all this can be very effectively managed, and we should be prepared to deal with this and not take it as normal ki ye to aayega hi. We have to face it and we have to learn to accept it. So, how to manage stress? Very commonly, we deny, we do not accept that we do not have stress. We go out and go out into holidays, take vacations like छुट्टी ले लेते हैं, घूम के आते हैं, स्ट्रेस कम आ जाएगा. But we commonly end up spending a lot of money, but we are back to where we started, and stress is still there. People look for solutions on Google. Very commonly, some people say कि हम तो सब कुछ छोड़ छाड़ के चले जाएंगे, जंगल में चले जाएंगे, संन्यास ले लेंगे, तो स्ट्रेस खत्म हो जाएगा, which is not right. Sometimes we take help from our friends and neighbors, look for solutions in astrologers. Why is this stressful period coming to our lives? कोई ज्योतिष हमें बता देगा कि स्ट्रेस कैसे कम करना है. And in the Western population, they like to go to the psychologist to ask for help and manage stress. But it is best to learn to deal with stress before it comes and be prepared for stressful situations because they will come to us on a daily basis. COVID did not announce before coming. No astrologer predicted the onset of COVID, and most of us were found unprepared for dealing this kind of a life situation. So stressors will keep coming. One of the four factors that I had enumerated, they will be there. So we have to find some kind of a solution to deal with stress. We know there are people who are very happily able to manage all these situations. They are not affected as much as some of us get affected with the same situations. So we have to learn those tricks. What is that? We need some kind of solutions which is having a universal appeal, which is simple, effective, very efficient, all of us can do, and has clearly shown results. And there, what we place this tool as meditation. So, meditation is now being considered as a medical tool, a healthcare intervention for helping people deal with stress, not only at the time of acute stress, but also before stress, in helping us prevent stress, in the sense that if we are meditating regularly, it is known that people who meditate regularly are able to handle stress better. And most of the factors that I have enumerated before are taken care of when we meditate. For example, in the heartfulness way of meditation, we have a goal, we have a purpose, we have a meaning to life. And very commonly it is a fear of death that we are talking about. But if you go into the literature of heartfulness meditation, it is said that every meditation is a training in dying. We are slowly embracing. When we meditate, we learn to embrace the unknown. We become more and more comfortable with the unknown, and we become more and more secure. The sense of fear goes from our lives, and we look forward to meditating every day. It gives us a lot of meaning, lot of positivity. Besides, it is
और
true that
मुन्नी रोज मेडिटेशन करते हो लड़ने को अभी
those of us who are meditating regularly, we know that it is now being scientifically studied, and it is shown that people who meditate regularly have a better quality of sleep, have a better immunity. Our metabolism is taken care of. We tend to not gain so much weight as non meditators do, and aging is even known to reduce by meditation. Similarly, for the mind, it is number one stress buster in the world. People who meditate are more calm, more balanced, more happy, joyful. They appreciate life more, and they are more positive than people who do not have the support of this practice in their lives. So as a heartfulness practice, there are several advantages which heartfulness offers compared to other kinds of meditation. This is because it is a very simple practice which anybody can do anywhere. There are no requirements, there are no fee charged. It is completely free of cost. And even completely uneducated people like drivers, villagers, electrician, maids are doing it, as well as very educated CEOs, people, scientists. Everybody is able to do it and derive the same benefits. It has a universal appeal, and it is very efficacious because of the power of transmission backing it. You start getting the results in very short period of time, within a few weeks, which take care of the effectiveness of this practice. So just a few slides to tell you that medically it is now the number one tool for stress management across the world. Very commonly, I see elderly patient demanding that नींद नहीं आ रही है, आप हमें Alprax लिख दीजिए, because आजकल chemists are not giving without prescription sleeping pills, anti-anxiety medications, and then you get used to it. There are many side effects. You will require higher and higher doses. I have WhatsApp messages coming for last week from a patient who's not able to sleep at all for last 5 days, and I'm continuously increasing the dose of the sleeping pill. Yet she calls up and says that there is no sleep for last 4 5 days. A lot of problems around her, and that is one of the reason why she's not able to fall asleep. So it has been scientifically proven that meditation is as effective as all the antidepressant drugs put together. Besides, there is no side effect, there is no tolerance, dependence on these practices. Similarly, there are studies from different parts of the world, like Africa also, which has shown that if we added meditation to people after heart attack and stroke, commonly you will see that after you have heart attack or stroke, we give you dietary advice, we give you exercise advice, but we don't talk about stress. And if you give advice related to meditation, it was shown that 50% risk of heart attack and stroke were reduced in people who were given advice of meditation, even in African continent. We at Heartfulness have also done studies. For example, this research paper on heartfulness meditation on burnout, emotional wellness, has shown that when people meditated for just 12 weeks in a hospital setting, they reported increased feeling of joy, calmness, harmony, and reduced negative emotions like anger, anxiety, fear, irritability. And this is a published study in a very reputed journal. Similarly, we did this study in collaboration with IIT Delhi. I was a part of this study and we did this in collaboration with the psychology department at IIT Delhi. We not only looked at the heart rate variability of and the effect of meditation and cleaning on heart rate variability, and this was published in the premier Indian Heart Journal of the country. We also looked at the emotional aspect after meditation and cleaning, and people reported how happy, how enjoyable, how peaceful you felt on a scale of 10. You can see most people reported it almost 8 or 9, feeling happy, feeling peaceful, feeling joyful. How demanding was it? Hardly any, 2 to 3 out of 10, very undemanding. So very positive practice, and we reported this study as a first landmark study from our country, seriously looking at meditation practices from the scientific angle, analyzing it in collaboration with the key institute, IIT Delhi, and my previous institute at Max Hospitals. We did this collaborative study. And when we presented this data to the World Symposium, we even won the best prize for the best research paper, talking about meditation as a tool for reducing stress and reducing the risk of cardiovascular disease. So we won the first prize at this World Symposium on meditation and cardiovascular disease. So I'm showing these slides just to bring home the point that meditation is not something very unscientific or something which we do only after retirement or when we have a lot of time on our hands, or for those people who have stress, they should do it. All of us, if we embrace meditation, it is now a recognized scientific tool which helps bring changes inside our metabolism, inside our body, and very importantly, inside the software of our mind. And because of meditation practices, we are able to modulate our thinking process. Our negative thought processes like anger, cynicism gets regulated. We become more calm, we become more peaceful, and we become more joyful. So these were other publications about related to the heartfulness practice, how meditating on the heart is the best way of rapid spiritual progress and getting those experiences in a very short period of time. And just to show you that meditation is no longer restricted to just Astha channels of the world, it is dominating the headlines even in the. You can see this is the most popular magazine of the world, and more than 15 years ago, it had a cover issue looking at the science of meditation. And we are looking at what happens to the brain when you meditate. Just 20 minutes of meditation, and they have shown with functional MRI studies that a lot of changes happen in the way the brain is functioning. So, a very useful medical tool for regulating our health, and of course, the number one tool for stress management. So, these are some of the powerful books which are talking about the scientific benefits of meditation, very clearly demonstrated. We know that those children and those people who meditate regularly are mostly in the alpha state and theta state, which means that they are relaxed, they are receptive, and they can be more creative and happy in these states. While if we are not meditating regularly, we are in beta state, always excited, and this is a state, if it continues for a long time, this is the state which produces stress for us. So American Heart Association, American scientific bodies clearly giving a very high scientific status to meditation as a practice for bringing down risk of cardiovascular disease. Prominent hospitals in the world having meditation listed under their headings. If you visit Mayo Clinic website and look for stress management, you will find meditation as the top of the list. They will not give you psychologist and psychiatrist numbers. They will give you meditation and tell you that meditation is a simple and fast way to reduce stress. And what we say in heartfulness, it is the best way to prevent stress. If you meditate regularly, the stressful situations, when they come, you will be better prepared to handle those stressful situations rather than taking it as an injection or a tablet after the stressful situation has already come. Prominent institutes of the country like All India Institute, AIMS, New Delhi, we had this conference in collaboration with AIMS, Heartfulness and AIMS, talking about meditation and their benefits on health for 3 consecutive days. You can imagine how a premier scientific institution is working with Heartfulness Institute. So, this is an idea whose time has clearly come. Let us embrace heartfulness practices. And at Heartfulness, we have certain specific tools specifically for managing and dealing with stress. We have this helpline number started during COVID times, a voice that cares. If anybody anywhere in the world is under any kind of stress, they would like to talk to people. Very commonly, it has been shown that if you are about to commit a very negative act like suicide, if you happen to talk to somebody, if you are able to get access to a counselor in time, you will be able to get rid of that thought process and come out of that thinking. So we have this helpline 24/7, a voice that cares, manned by trained people, which help you deal with stressful situation. And the other tools at Heartfulness specifically addressing stress are like stress detox techniques. We have a simple heartfulness relaxation for 4 5 minutes. We offer left nostril breathing for acute panic attacks. I have been using this in my patients and getting very good results to people who are prone to sudden panic attacks, sudden attacks of anxiety. When they do left nostril breathing for just a minute or two, they report feeling calm and relaxed. Meditation, of course, has a very calming and soothing effect when done regularly, at least for a few weeks. And then we also have some practical tools like guided limb cleaning, which helps us deal with severe levels of stress in a very effective way. So we can get access to these, get in touch with a heartfulness trainer, and get rid of stress. We can also start reading these bestseller books, which offer these tools in a simplified way and in a very scientific manner. They have been presented. Wisdom Bridge, I would like to talk about, especially in the light of this topic, which is about elderly people. Revered master has talked about the elderly people as the sacred wisdom bridge because they are a repository of knowledge. When I sit with my mother, she is full of stories, full of knowledge, which is, of course, not to be found even on Google or ChatGPT for that matter. How to prepare different kind of pickles, how to prepare different kind of dishes, for example, which are no longer being cooked nowadays. So, elderly people are a storehouse of knowledge, and this is the wisdom bridge we should look after, we should care for. As junior members of the society, we are duty bound to look after our senior citizens of our society so that they do not feel stressed, they do not feel lonely, and they feel loved and looked after. Spiritual anatomy is again a very scientific exposition about the spiritual architecture of our body and how the heartfulness meditation practice ensures speedy spiritual progress in a very methodical way has been given in this book. So this was all about heartfulness practices, and I pitch them as a tool for preventing stress. And of course, we have certain tools for dealing with stress. Here I am showing the US armed forces before going to war are being given meditation session. The US Army personnel being trained. Of course, our armed forces also are collaborating with the Heartfulness Institute and getting trained in these practices, which will help them deal with stress in a very positive way. And you are all aware how the police forces are joining hands now with the Heartfulness Institute so to learn these skills and become less and less stressful. But all of us need, even at workplaces, we are doing these kind of workshops so that we are able to manage life better and take life as a joyful enterprise, as an enterprise which is an opportunity given to us as human beings to rise high and not fall prey to negative emotions and negative thought processes. We can also download this freely available app and experience the different tools which I have just enumerated for managing stress and for embracing these practices on a regular basis. So let us create a stress free society, a positive society, a happy and joyful society. Thank you so much. If we have time, I'll take a couple of questions and then we'll have a brief experiential session on meditation.
Dear brothers and sisters, you may ask any question that you have from Dr. Rahul, or you can even put that in the chat box as well.
I have a few questions. Can I take them?
Dr. Rahul, my name is Badul Dash. I have been, can you hear me?
Yes, audible.
So I have been doing the meditation, heartfulness meditation for last 20 years. But still, I feel in some point of time, it is very difficult to manage anger. Of course, what 20 years back, what sort of anger was there, but nowadays I can control a lot of things. But still, it sometimes it kills us. Can you suggest something?
Thankful to you for being very honest and bringing this out.
Yeah.
Even after 20 years of practice, all of us know that we are sometimes given to these negative emotions. And heartfulness, again, is a very, I call it a wonderful scientific tool because clearly in heartfulness, the unique way is that you do not treat anger as something negative. We have clear literature which is showing that kama and krodha are part of our being. So we need not to feel guilty about it also. It is a natural response from our side. Number one. Number two, what we have to see is that one, please don't feel guilty about it. We have certain tools like we can practice bedtime when we go to bed. The 10th maxim, we embrace our weakness. If something has gone wrong during the day, we vented our anger, which was unreasonable to the given situation. Then it is, of course, we put forward, we resolve that we will not repeat this, and we pray that this negative trait in me be taken care of. But a genuine, reasonable anger appropriate for the given situation is, of course, required. If the senior citizens do not correct the children appropriately, getting angry and even slapping the child who is misbehaving, then that is justified. It is only unreasonable anger, irrelevant anger, which should be worrying us. And we take care of it sometimes with spot cleaning. If you feel that you are getting angry and you're not able to control it, we can sit down, do spot cleaning for a couple of minutes. Left nostril breathing is very helpful in these situations, which calms us down. And at bedtime, when we resolve not to repeat it, we find that we are getting better at it. But we need not to carry it in our thought process. We just move ahead.
Thank you, brother. Thank you. Thank you so much.
Thank you.
Yes, myself, can I say something?
Yes, sir.
Myself, Dr. Parjat Tripathi, I'm an Ayurvedic consultant and working, I mean, also associate with the heartfulness from last 25 years. And I'm getting tremendous result with my wife and me, on my daughter also. I'm a counselor for Voice That Care even.
Okay.
So अभी कई बच्चों के साथ मेरी काउंसलिंग चल रही है and last 2 to 3 years I'm counseling with the student of CA and medical. There was deeply depression and after that counseling with them from last 2 to 3 months they are very good doing. So counseling is very important. I mean, as Daji has made this Voice That Care, this helps a lot. So, and even this heartfulness meditation is one of the best tool to have to be maintained. So this is my request to everybody should do the heartfulness meditation, should go to the meditation from above our team. If somebody is not associated with the heartfulness, they should continue with it. And if anyone want to help my support from Voice That Care, I can ready for that. Thank you.
Thank you for bringing this out. Thank you so much.
Dr. Rahul, there are some questions in the chat box. Sister Purnima is asking, Sir, I'm not being continuous in meditation. What to do, sir?
Be continuous. That is what we say. But don't feel guilty about it. Don't feel negative about it. I remember when I was a medical student and I started this practice, and when I was doing my post graduation, and then when I was working, most of the days, because of the irregular shift timings, like morning duties, evening duties, night duties, I was not able to meditate regularly. And we also had to go out on ambulance calls, even out of town ambulance calls. So completely unregulated timings. So when I used to tell my preceptor about this, the simple thing was he used to tell me, don't worry about it. Even if you are doing cleaning, it's okay. Whenever you find time, sit for 10-15 minutes. It's okay. It is okay to remain connected. Try to have a schedule if possible. But even then, if you're not able to regulate, don't feel bad about it. Take it from wherever you are. And that is another advantage of heartfulness, that it is a very flexible system. You can at least do cleaning 10-15 minutes. You will have time every day for that, if not meditation early in the morning. So be very flexible if time is not permitting you to do it, but keep trying to be keep trying to be regular at it, and you will soon be able to master it.
Another question from Brother Ramesh. How to convince stressful person for meditation?
So don't convince. I often say this is a very wrong word. We should be leading by example. If you are meditating regularly, your workplace colleagues, and I speak from example, I did not announce to anybody that I am a meditator or I'm a heartfulness meditator, but in my department of people, automatically they picked up. What do you do? Why things don't affect you so much like we are affected? What do you do? And now they tell me that, oh, आप तो meditate करते हो तो आपको तो effect कम आता है. So just don't convince. Just tell them what you are doing, how you find it effective, and they will themselves be attracted to it. Uh, Offer them this practice, share it with them, take them along sometimes, but don't go out of your way trying to convince them of the effectiveness or things like that. They will come when they need it.
Another question from Sister Lakshmi. Any training session on meditation available from Heartfulness?
I think you can answer it better. Lots of ways by which you can get connected to heartfulness. I've shown you one of the apps, the Heartfulness app. You can download it, connect with a trainer in your locality, send a message or an email. You will be connected to a trainer or a hotspot, and you can begin the practice in a systematic way. Trainers are available in most cities of the country if you are in India, and in most countries of the world if you are even outside. We can even have a remote session if you don't have a trainer in your town. Again, with the help of master classes available in the app or by our website, heartfulness.org.
Sister Shweta is asking, what is the best way to reduce the severe continuous gross tension to normal tension?
If you are finding it difficult, if you have a severe condition, I would suggest you to seek medical help with a psychologist or a psychiatrist. Should not escalate out of hand. Meditation, as I mentioned, is a very good preventive tool. But if you are already in the midst of severe stress, it is good to have expert help taken from in the form of psychologist or psychiatrist. And they themselves, after the medical therapy has worked, they will guide you towards meditation on their own.
One brother is asking that he is 60 and not getting a sleep daily, sometimes 2 to 3 hours only. So would Ayurvedic be best?
Yes, we can try all these tools. I've already mentioned some of the heartfulness tools. We have some tools specifically for sleep also. You can imagine a block of ice above your head while lying down, and it will send cooling waves and you are able to sleep. You can do relaxation in a lying down situation, which helps you fall asleep. We have a music also which you listen to while sleeping. It gives you good sleep. But mostly if you are meditating regularly, most people do not have sleeping problem. Having said that, if in spite of these measures you're not able to fall asleep, sleep is important. Look at reasons. If there could be some reasons, I commonly find that people are using uh, the smartphones or screens even late in the night, and then our mind is activated. So even if you looked at a screen for 5 minutes, say, you will not be able to sleep for an hour at least after having looked at the screen because your brain gets activated. So we have this formula of 3 to 1. At least eat your meals 3 hours before your sleeping time. Stop all your gadgets at least 2 hours before your sleep time. No screen time before your sleep. Exercise, keep active during the day so that you feel tired and you will naturally fall asleep. If all these measures are not the cause of your disturbed sleep, then you should seek medical help, be it Ayurveda or be it allopathy. If help is required, we should take it from medically and not deny it.
कितनी जगह भी चले जाओ.
We also have effective medications available, very safe nowadays with allopathic
हाँ तो
medicine.
Sister Shweta is asking, brother, that can we do limb cleaning and left nostril breathing number of times in day,
Yes,
and that
no
too
harm.
regularly to reduce cross stress?
No, not for cholesterol. These are left nostril breathing is particularly for acute panic attack situation, acute anxiety situations. For example, you are going to face an interview or you are going to give a talk on stage or for any performance and you are feeling stressed just before that. So do 1 or 2 minutes of left nostril breathing. You will calm down, you will relax. Even before examinations, if you do that, you will definitely calm down and get relaxed. Doing it multiple times usually will not be required. But if it is required, it is harmless, no problem.
One sister is asking, hello sir, very good session by you. How do exercise and warm up help in relaxing?
Yes, stress exercise, we call it as a free of cost tool for reducing stress. We are taught that if you step out of your house, the first step that you take for your walk out of your house, the stress is left behind. It is very good to get out and go for walks in natural surroundings. It calms our body, relaxes us, and definitely is very soothing for stress. You look at trees, flowers, birds, they give you a lot of happiness from inside. Instinctively, we are built for that. So if you are thinking continuously sitting indoors, get out, go out of your house, take a walk, you will feel better. So, yet it works.
I think these were the questions. I think, not sure if we have that much time, but Bhaiya, do you want to have a short meditation session now?
Okay, we can have for 10 minutes maybe.
Yeah, sure.
Yes.
Can do that.
So let's sit in a comfortable position. Gently close your eyes. Let's begin with relaxation first. Wriggle your toes and feel them relax. Relax your feet and ankles. Feel energy from Mother Earth travel up your legs, relaxing them. This healing energy is traveling up through the knees, thighs, and hips, relaxing them. Feel this energy travel up your entire back, right up to the top of your head. And your complete back is getting relaxed. Relax your abdomen and chest area. Deeply relax your shoulders and feel them melting away. Relax your arms, each and every muscle of your forearms, your palms, right up to the fingertips. And relax your neck muscles. Move your attention towards your face. Relax your jaws, your lips, cheeks, nose, eyeballs, forehead, earlobes. Deeply relax your head. You see how your whole body, from top of your head to your toes, is completely relaxed. And gently move your attention towards your heart. Make a suggestion that the source of divine light already present in my heart is attracting me inwards. Stay on this thought till I announce the end of meditation. That's all. Ending the session.
Thank you. Thank you so much, Dr. Rahul, for the
For
amazing.
everybody for joining.
There is one question. Would you like to address that right now?
Yeah, sure.
One sister is asking, rapidly reducing in weight due to not getting sleep. Please guide, sir.
It is an unhealthy thing to lose weight. You're eating properly. Get yourself checked up. And sleep definitely is very important. If our simple measures fail, lifestyle changes that I just suggested to bring you sleep, then it is good to consult a medical practitioner, Ayurveda practitioner. There are safe, effective drugs available for sleep, uh, taken under supervision. So please seek medical help if these measures are failing in restoring sleep. And weight loss is a very important sign. There could be some other reason also. So please get in touch with your your physician.
With this, we come to an end of our session, dear brothers and sisters. And thank you so much, Dr. Rahul, for taking us with an amazing topic, stress. I think we all learned the stressful factors, how stress is inhibited, the management of stress, and how meditation helps in reducing stress. So thank you so much all for joining. Before we go, if any participant wants to learn stress relieving techniques or learn to meditate, they can message in their respective groups, and we will share the relaxation techniques along with certain other yoga nidra sessions, and we'll help you all to meditate as well. And the WhatsApp group will be open for any feedbacks as we do every day. Thank you everyone for joining and hope to see you in the next yoga session tomorrow. Thank you. Thank you, Dr. Rahul, again.